Hello, I'm Dr. Pierresamaan, and it's wonderful being back with you as we continue in this series on unmasking addiction. We're speaking about recovery and relapse prevention in these last 3 or 4 episodes. Today we're going to be zeroing in on detox. And I think we could say there's 4 phases of recovery. When someone begins and goes through those different stages, and that first one is detoxing. And detoxing, I think it's the most important, really, among all of them, but we'll be getting into the others later. So there's detoxification, there's initial abstinence, there's long-term abstinence. Abstinence also means sobriety, so many people will identify it as initial sobriety, long-term sobriety, and of course continuous recovery, or we could say continuous sobriety. Detoxification is the first step in the addiction treatment. If client is still consuming drugs, alcohol, or still participating in their addictive behavior, whatever it must be, they've got to stop. It's just, start going in, okay, no more of that stuff. Whether the client depends on a substance or behavior, the body's chemistry, their mind, their thinking, their metabolic flow, their body rhythm, the whole thing that makes you who you are has to get back in balance. So it's out of balance when there's drugs, alcohol, or even behavior. Your chemistry is going to go out of whack, put it simply. And if it's out of whack, you got to get it back in tune again. Without the body metabolizing the drugs or the behavior that's creating additional dopamine, norepinephrine, stress hormones, and whatever else that it's creating. Without that, then you can have a chance of getting it into balance. And treatment, you're going to benefit from treatment. The initial phase of detoxification, there's unpleasantness associated with it. I could say it that way. It's physical, it's psychological, and it doesn't stop right away, especially if someone's been abusing or using for a length of time. It can take a little while. So reducing the substance helps reduce the withdrawal symptoms over a period of time. The feeling of being unhinged is a characteristic that's often identified when someone is going through a withdrawal syndrome. And I don't know, if you look at your history, whenever you felt unhinged, whenever you felt vulnerable, multiply that a few times, and you might get that impression of what it's going to be like in going through recovery. In fact, I might even say, if the longer you've been doing whatever you've been doing, you might want to multiply that maybe 100 times. It can be that upsetting, that severe. Symptoms can include anxiety, fatigue, sweating, vomiting, depression, seizures, hallucinations. I recall when I worked in the psychiatric unit when I first started off in my career, and we had the substance abuse unit there as well. It was a locked facility, and so we would get some very severe cases, and the detox could be quite severe for some of them. And in many cases, the psychiatrists, the neurologists, or the addictionologist would recognize this person needs extra help, and they would get them the medications they needed to get them through 2 or 3 days of severity, whatever withdrawal symptoms they were experiencing. Those are the real bad ones. And certainly the locked facility was necessary, because even with the medication help, even with that extra putting them down, making them sleep, getting them through that very worst of times, sometimes that adrenaline is so strong that even the medicine wouldn't help, and they'd need restraining. And usually they don't need restraining till after you identify they're trying to get out. And then you have to realize, oh, we got to do something here. So psychological withdrawal encompasses the psychological consequences of stopping the use of addictive substances, and can also occur when someone gives up a habit, a behavior. Shopping, that you ask some people about giving up shopping, and they'll tell you how it affects them. Gambling, certainly, and pornography is a big one nowadays. It could be a number of other things that perhaps can cause withdrawals for you. According to the Substance Abuse and Mental Health Administration, there's 3 types of withdrawals that they've identified. Acute withdrawal is the first one, and that's okay. It's uncomfortable. It's obvious. You can see it. There's symptoms going on. Protracted or long-term withdrawal is the next one, and then post-acute protracted syndrome. You can also call it a withdrawal, but it's going on and on and on. The withdrawing doesn't seem to go away, so they also identify it as a syndrome. Acute withdrawal consists mainly of physical withdrawals, physical symptoms that last a few days. It can last 2 weeks. Oftentimes in the past, when I was working in the psychiatric unit with the substance unit, 3 weeks, usually is what we would say, 2 to 3 weeks. 2 weeks for sure. That third week, the fog was still there. The difficulties in focusing was still present. The fourth week, clarity, and they were absorbing what they were hearing, and they were interacting, and they were gaining from what they were learning and helping them. And unfortunately, then insurance would run out, 28 days or 4 weeks. Out they would go, and we'd have to get them into a good program, recovery program that continued the work. Otherwise, certainly 30 days is not enough. Symptoms of acute withdrawal are immediate, and they can be a symptom that's simple, like headaches, vomiting, or anxiousness, or they can be other types of symptoms, but it's happening now. And because it's happening now, we want it to go away. And so they call it acute. And it occurs with substances that are used, but also with behaviors. And so substances like alcohol, whenever that's abruptly stopped, that body is going to say, I need more. It's no different with eating. If you immediately stop eating, if you're deciding to fast for a few days or a week, what is your body saying to you? Those first 3 days are the toughest. Within acute withdrawal, delirium tremens can occur, and those are commonly called DTs. DTs are the most severe type of withdrawal syndromes. There's a craziness about you at that moment. In fact, some might say they're psychotic at the moment, but maybe not quite that far, but they're on that edge. Signs and symptoms of it can include confusion, excitement. They get elevated, very, very quickly, agitated very easily. It can be very explosive, so that those times, those certain individuals you have to be careful being around. And their moods can be up and down just in a flash. Protracted withdrawal syndrome are symptoms persisting for months to years after a substance has been stopped. So things like benzodiazepines, opioids, alcohol, and other Drugs such as psychedelics, for example, can lead to long-term withdrawal, or similar effects and symptoms can persist for years after the use. A lot of people don't realize that doing psychedelics, for example, the particles stay in the brain cell sac that feeds brain cells. So you have the brain cell stem, the brain cell itself, and the dendrites, and there's a sac around the brain cell that holds nutrients that feeds the brain cell to produce the neurotransmitting chemicals like dopamine and epinephrine, norepinephrine, and serotonin, and so on. Well, the nutrients remain there, and unfortunately with psychedelics, the particles remain in that sac. And a particle can stay there for years and suddenly get absorbed. So someone could seem perfectly fine for months, for several years. Suddenly they have an experience as if they were just doing their psychedelic drug, and it's, whoa, you know, what just happened there? Well, they got that particle, it went through, got absorbed, and it stimulated whatever neurotransmitting chemicals it was going to stimulate, and that can happen. And you don't want it to happen when you're driving a car, and you don't want it to happen if you're doing anything detailed or anything that's going to require full concentration. That's why it's not safe doing those things. There's going to be lasting results. And then, of course, the worst of all with withdrawals is post-acute protracted syndrome, which is commonly called permanent withdrawal syndrome. So sometimes the initials PAUSE are used. So PAUSE may also be referred to as post-withdrawal syndrome, prolonged withdrawal syndrome, or protracted withdrawal syndrome. The most common symptoms of PAUSE includes difficulties with thinking or cognitive tasks, learning, problem solving, memory is a problem with that, irritability, thoughts and feelings of fear and panic or depression that just never seem to go away. They persist over time. I recall a friend who, out of high school, got heavily involved in drugs, and after 10 years or so, came back to his family, and never the same, never able to be what he once was because of this post-acute protracted syndrome that occurred, damaging the brain. So you don't know, is this going to damage somebody permanently, or is it only going to be, like a lot of people, just a short period of time? That's the risk you take when you get involved with addiction. Access for following associated and increased patient risk is important to understand. How risky is it in dealing with someone who's in recovery? There's a history of alcohol or drugs, so you want to know, well, what is that history? You need to get that information. You need to understand, has there been a history of DTs in their past experiences in their recovery? Are there numerous prior withdrawal episodes in their recovery? Is there a comorbid medical or surgical illness involved, especially if there's been a history of brain trauma? Are they over the age of 60, 65? Have they experienced moderate activity in the years prior, or has their activity been very limited? Do they have any chronic conditions? Is there a suspected head injury? Because a lot of times they're not going to tell you, and so you have to get the history and begin to fill in the blanks when you get that history to realize, yeah, there's a high likelihood that this person had a head trauma because, you know, he said he was in a car accident. And okay, well, you know, sometimes you can hit your head and even pass out and not even know it, and that can create difficulties in recovery, added difficulties in recovery. Long duration of heavy use of any kind of stimulants, the longer the duration, the worse the recovery can be. Seizures is a big deal. You got to find out, hey, is there a history of seizures? Is certainly a history of epilepsy, but there can be intermittent seizures for other reasons. And so it's good to get a medical record of that individual before accepting them into a treatment program to know what the risks may be. Is there marked autonomic or involuntary hyperactivity occurring in that individual? And is there a physiological dependence on certain medications like benzodiazepines or barbiturates? Is there anything associated with the withdrawals that they may have had in the past, any addictive substances that they have added on that perhaps they're not telling you about? Positive blood in their blood alcohol, positive blood alcohol concentration, signs and symptoms of that. Signs or symptoms of co-occurring or simultaneous psychiatric disorders are active and reflect a moderate level of severity. Do you see that? Are they experiencing that? And a very important thing is risk of harm. Gosh, so many people, they seem fine when you begin to speak with them, and then a trigger occurs. And so you need to know that in advance. Is there a risk of harm for this individual who is in recovery or you're thinking of accepting in recovery? And that's if it's mild, you know, just a risk of harm. There's a lack of commitment usually. When you notice there could be a risk, you start to see lack of commitment, lack of cooperation. They're not being reliable in the questioning. Okay, now then you identify risk of harm with that individual. Imminent risk of harm, well, they're not being cooperative, they're not reliable, it seems to be more intense than the previous, and that leads to a greater or significant risk of imminent harm, imminent relapse. We don't want that. If there's an imminent risk of harm, gosh, maybe they need to be considered to go into the hospital psychiatric or the hospital substance abuse initially, get through that 30-day period before going into an outpatient or a residential treatment program. The two most common point of use drug testing methods is saliva and urine. There's other factors influencing drug detention that include person's weight, their tolerance of drugs, methods of drug use, their activity, their diet, their metabolic rate, their age, and so on. So there's a lot of things they have to look at depending on the particular drug. It can take days or months for many drugs to clear the detection. So some drugs can last 2 to 3 months in the body after use. So just taking it the day after or a week after, there's not always guarantee that you're going to identify things there. Medical care during treatment's important for many, certainly not all, but for many, that medical care may include medications. Certainly everyone needs to be monitored in a medical sense because you never know what's going to happen. So there needs to be some presence of medical staff, someone who, perhaps a nurse or someone else that's medically certified in that area, to watch over and make sure, test the blood pressure and other things that are occurring there, because those things are going to be bouncing all around, and you never know. Is someone on the edge of a stroke? Is someone on the edge of a heart attack? Is someone on the edge of a seizure? They may not have had a history of that, but that stress of going through detox is so great, it can push them over that edge, and they need to be prepared for that with everyone. Assessing the severity of drug toxicity is vital in determining the need for medical detoxification, the degree of addiction, the likelihood of severe withdrawal, the presence of medical or psychological problems, the patient's response to recommended treatments, the possibility of relapse, and the environment for recovery. All of those things must be determined. During detoxification, various drugs will alleviate withdrawal symptoms and minimize initial drug cravings. But I want to stipulate this. Medications are a help. They're not a cure. And medications may help the individual get through that initial detox, the difficulties of it, but medications are not the answer. So using some medications are important, and that's where the medical provider has to be able to screen each person before they're accepted into a treatment program, whether it's a residential program or in hospital. Certainly you have the medical facility and the doctors there. But in the residential program, they need a medical professional who is screening them, evaluating them, giving their assessment and approval that this person is okay to enter this program. And there's different medicines that are often used, and we're not going to get into all the details because of time, but clonidine is one of them, phenobarbital. You can pause this video anytime and read about them. Methadone is one of the more popular ones that's often seen. Buprenorphine is another one, naltrexone. And not only those medications that are more focused in recovery, but you got the psychiatric medications that might be like antidepressants that are often used, and they'll be helpful. They'll calm the person, or they'll give them the help they need to get through not only the initial phase, but get through the entire recovery process, especially if they've been diagnosed with depression or anxiety in previously. At that point, okay, yeah, they may need that extra help. Later on, they can stop, but they stop based on what the doctor says, what the psychiatrist is telling them. And in some cases, they can turn to supplements. And most of my clients nowadays, they're on supplements, on herbals that help them, and they're being followed by their physicians. And certainly there's the anticonvulsive medications for those with a history of seizures, can be very helpful. Again, those aren't cure-alls. Those are like Band-Aids to help get through the difficulty, because in recovery, it's not give me something to fix me so I can feel better. It's the work that you do to change your character, because what gets someone into trouble in addiction is their character has been stymied. It's immature. It needs growth. It needs work. And the character doesn't get better when they're in the middle of their addiction, whatever the addiction is. The character actually deteriorates. To improve character takes the inner work that's done in maturing oneself mentally, how you think, how you respond, emotionally, how your emotions are, so that your thinking is controlling your emotions are not controlling your thinking, and maturing in behavior so that emotions are not controlling behavior, but thinking through problem solving and so on has that control to where the behavior is healthier behavior, which is going to result in a better result or a better event, a follow-up, creating more positive cycle of think, feel, do cycle. We want that positive cycle. And to do that, we have to build our characters. We have to have good character. And that's the work that's done in recovery. It's not just the detoxing. Social or non-medical supervised programs require clients to undergo either medical detox or a 72-hour clean and sober period before they'll even accept them into admission. Well, what's a biblical step? Biblical step 3 might say, we choose to open our hearts to God and let His power transform and heal us from within. Made a searching and fearless moral inventory of ourselves. It's thinking, it's reviewing, and it's looking at my heart and saying, who am I? What am I really? What do I need to change in me? How do I need to improve my character to be a better person, a better friend, a better family member, to like myself better? I want to like myself more. And if I like myself more, I'll have an easier time liking you. And you'll have an easier time liking me. If I'm doing all of that, my character is growing, it's maturing, it's where it's supposed to be. Well, what does the Bible say about this? In Psalms 139, verses 23 to 24, we read, "Examine me, O God, and know the deepest recesses of my heart. Test me and identify every troublesome thought." Isn't that what we're doing in recovery, isn't it? Yeah, especially through that detox point. But that whole process is examining me. And now I'm asking God, show me, reveal to me, because I've been blind. I can't see I got a problem. There's nothing wrong with me. I'm perfectly fine. Everybody else is the problem. Well, that's a faulty belief that now you believe the lie to be true, and the truth is a lie, and now that's got to get reversed somehow. And that takes examination, not only from others, but from God also, because He brings that to our attention from within. So test me and identify every troublesome thought. Determine if there's any unhealthy way in me and lead me back to everlasting life. Well, open up your Bible, start reading some of that stuff, see what God is saying to you as you're reading, because He speaks to us through those scriptures. What's He putting into your heart? What's He revealing to you that He's saying, okay, you did good here, now you can work on this area. You can be better here. Let's get a little stronger in this area. He'll show you that if you ask Him. And asking Him means you're ready to receive from Him, whatever that might be. Well, we're going to continue we talked about detox. We're going to continue talking about the other stages next time. May your troubles be more minor, blessings more, and happiness come through your door. God bless.